Good morning. Before we begin, I would like to ask for a moment of silence for all of the healthcare workers who have lost their lives treating patients with COVID-19. This includes Adeline Fagan, who lost her life on Saturday. Thank you. Adeline was a 28-year-old second-year obstetrics and gynecology resident in Houston who actually began her medical education right here in Pennsylvania. Adeline's family said that she wanted to deliver babies. She was doing a rotation in the emergency department treating COVID-positive patients when she contracted the virus. Adeline wanted to be a doctor to help people that are less fortunate. Adeline speaks for all of us in medicine and public health with her dedication, kindness, and heroic efforts to save lives, even at the expense of their own. She encompasses why we are here in public health, why we continue to fight to save lives with measures like restricting the attendance at large events. It isn't to stop our way of life, it's to save lives. To save the lives of our children, our parents, our spouses, and our partners, our grandparents, our brothers, our sisters, and heroes like Adeline who take care of us when we are at our most vulnerable. It is why the testing strategy that Director Huff is going to introduce to us today is so important, and why the information about insurance carriers covering testing, as discussed by Commissioner Altman, is so important. And it is why the legislature should stop wasting time trying to overturn vetoes of public health measures that are designed to save lives. I can't stress this enough. We must be united. We must be united in our efforts to stop the spread of COVID-19. So at this time, I'd like to turn things over to Director Michael Huff to talk about our testing strategy. Thank you.
Thank you, Secretary Levine. Good morning. My name is Michael Huff, and I am the Director for Testing and Contact Tracing in the Office of Governor Tom Wolf. I'm responsible for coordinating and implementing the Wolf administration strategies to ensure testing is accessible and available to the citizens of the Commonwealth, and that contact tracing efforts for containing COVID-19 are deployed effectively. It's our priority to ensure that all citizens of Pennsylvania who want or need a test will have access to one. However, priority attention will be given to those who are most vulnerable. Individuals will be offered testing based on a prioritized, tiered approach utilizing the following test types. A PCR test, which is the gold standard, but supply and turnaround time can be a challenge. An antigen test, which is much more widely available, and results can be within the same day. However, it has its own challenges with accuracy. The prioritization supports public health officials, healthcare providers, and laboratories in determining who should be tested given the current environment of the COVID-19 pandemic in Pennsylvania. Tier 1 priority, or the highest priority for testing, is hospitalized individuals with signs of symptoms of COVID-19, symptomatic individuals who are close contact to a positive case of COVID-19, and asymptomatic individuals with certain underlying health conditions who are also close contacts to a positive case of COVID-19. Tier 2 priority of testing are all individuals with COVID-19 symptoms, close contacts of confirmed cases who are asymptomatic, individuals who are asymptomatic who live in congregate care facilities, and individuals who are asymptomatic who work in healthcare, non-long-term care congregate care facilities such as a homeless shelter, home health care, emergency services, child and adult protective services, correctional facilities, and compassionate care and hospice services. Tier 3 priority is for testing is based on the COVID-19 prevalence in the community. For asymptomatic individuals who work in areas that have frequent interactions with the public and may not have the ability to maintain at least 6 feet of space on a consistent basis. For example, retail and manufacturing, food services, to name a few. Tier 4 priority for testing includes individuals who are asymptomatic who do not fall in any other categories. A foundational aspect of our testing strategy requires us to use available testing resources in an efficient and effective manner. As the field of diagnostic testing evolves and antigen tests become more readily available, we must ensure that the most suitable type of test is being administered to our citizens. To that end, we continue building up our COVID-19 testing capacities to prepare for future outbreaks and surveillance to rapidly identify disease and mitigate it. The key to quickly respond as the landscape changes. The COVID-19 pandemic will continue to evolve quickly as the tools, research, and data are improved to protect public health. As more information becomes available, we will continue to refine our approach based on scientific evidence and input from the communities. The Commonwealth will continue to review where the greatest need for testing is and leverage testing capabilities accordingly. And for more information, I encourage you to visit our website at www.pa.gov. I'd now like to introduce Jessica Altman, Pennsylvania's Insurance Commissioner. Jessica.
Good morning, everyone. My name is Jessica Altman, and I have the privilege of serving as the Insurance Commissioner for the Commonwealth of Pennsylvania. I want to thank Governor Wolf and Dr. Levine for inviting me to speak today. I also want to recognize the dedicated team of Commonwealth employees who have worked tirelessly to make sure all Pennsylvanians know their COVID-19 testing and coverage options. While Pennsylvania and this nation deal with the COVID-19 health crisis, it is imperative that we ensure access to quality health care, to testing, and to treatment. No Pennsylvanian who needs a test should forgo that test for any reason, including the fear of what that test may cost. The Insurance Department wants to assure Pennsylvanians that if they lose their employer-sponsored health care coverage because their employment was affected by the COVID-19 outbreak, there are options available for them to continue to have coverage. In Pennsylvania, individuals and families can secure coverage through the Affordable Care Act marketplace, and in addition to the ACA medical assistance, the Children's Health Insurance Program, and COBRA that lets you maintain your employer coverage following employment are also options. In fact, last year, Governor Wolf signed Act 42, allowing Pennsylvania to transition our insurance ACA marketplace from healthcare.gov to our own state-based platform. Beginning for coverage that starts January 1st of 2021, the way that individuals and families who buy insurance on their own access coverage in Pennsylvania is changing. Yesterday, Penny officially launched in Pennsylvania. Penny is the state's new self-sustaining health insurance marketplace and the home for high-quality, affordable health insurance plans beginning in 2021. As a part of today's announcements, where we heard Dr. Levine and then Director Huff outline the Commonwealth's priorities for testing, We have also released additional guidance that aims to help Pennsylvanians understand what coverage for COVID-19 they are entitled to under their health insurance plans. I'm going to walk through some highlights of that guidance, particularly as it relates to those with the commercial health insurance products that my department regulates. Generally speaking, any kind of comprehensive medical insurance, including through Medicare, Pennsylvania's medical assistance or CHIP programs, or private health insurance plans in Pennsylvania, testing is covered if your healthcare provider determines that it's appropriate and needed. When your healthcare provider says you need that test, all of these types of insurance provide coverage without any out-of-pocket costs for you, like co-pays or your deductible. This includes the test itself, but it also includes any other costs associated with receiving the test, such as the fee to the provider or facility administering the test. My department regulates private insurance plans sold in Pennsylvania, and I want to stress that these plans are subject to federal law that requires this coverage. Although I would also note that all of Pennsylvania's major insurers were providing this coverage even before that legal requirement was in place. Now, if you have insurance intended to cover some of your healthcare costs, but is not comprehensive major medical insurance, like an accepted benefit policy, a short-term limited duration plan, or a healthcare sharing ministry, your plan may or may not provide the same coverage because it's not subject to the same requirements. However, if you have these plans, you are actually considered uninsured under the Families First Coronavirus Response Act, and that same act may provide options to cover your COVID-19 testing. If you have one of these plans and are concerned that the coverage you have is not the coverage you need given the time, open enrollment for Penny will begin on November 1st for coverage beginning on January 1st. All plans on Penny are comprehensive, cover the essential health benefits, and contain all of the consumer protections that the Affordable Care Act promised. Also, I want to note that if you experience a significant life change, which includes the loss of other insurance coverage, such as losing insurance through your job, you may be eligible for a special enrollment period to secure comprehensive coverage right now, and this coverage will often be more affordable than the option of COBRA, so you should explore your choices. Finally, I want to note that both Pennsylvania's Medical Assistance Program and the CHIP program enroll year-round if your income qualifies you for those programs. With COVID-19, our health has never been more on our minds, and our health insurance coverage has never been more important to our peace of mind. I want to stress that there are options, and there is help navigating these complicated questions if you need it. Finally, we all know health insurance is complicated, and while we haven't seen many complaints or issues related to coverage in COVID-19, if you believe your insurance company should be covering COVID-19 testing or treatment and isn't, you need to determine what kind of healthcare coverage you have and contact the appropriate agency. That is what the information being released today will help you figure out. The insurance department is here to help. If any consumer has questions about their insurance or an issue with your insurance, I encourage them to contact us. If any consumer has testing or treatment related to COVID-19 denied, I especially encourage those consumers to contact us. If we are not the right place to help with the type of coverage you have, we will get you to the right place. But this guidance, once again, is a great place to start. In closing, our website is insurance.pa.gov, and our coronavirus page has information for consumers, providers, and insurers. Thank you. I'm going to turn it over to Dr. Levine for closing.
Thank you. Are there any questions? Well, thank you very much. We appreciate your attending our virtual press conference, and have a wonderful day, and stay safe.